honest and uncensored show about plastic surgery, health, beauty, and lifestyle with your host, plastic surgeon Dr. Bruce Hermann, and your co-host, entrepreneur and social media influencer Sarah Bennett. Now it's time to discuss the good, the bad, and the ugly of the topics everyone is talking about. It's time for Nip Talk.
Welcome back, everybody. Thank you so much for joining us. We really do appreciate it. I am your host, plastic surgeon Dr. Bruce Hermann, and with me as always is the wonderful Sarah.
Howdy.
And Travis, you out there in the box, buddy?
I am.
How you doing, man? You do good?
I'm good. How about yourself?
Doing good. Just enjoying Friday. I love Fridays. Get to do the show. It's the end. It's ready for the weekend.
It's a good bow on the week, right?
It is. Now, Sarah, I understand you're going camping this weekend with your daughter?
Yes. I'm like, which weekend? I'm going camping 2 weekends. One weekend I'm taking her to go see like my sisters, and then we're going to a pumpkin patch, and then I'm going to take her camping in that weekend.
Now, when you camp, are you in the tent, or is this like glamping?
No, I'm in a tent.
You're in a tent?
Yeah, I'm taking my 4Runner, and my 4Runner has a tent on top of it.
Oh, I've seen that actually.
Yeah, they're really great. The only downside is that like, if you have to like travel anywhere to enjoy like whatever camping is like, or whatever activities are available like in that camping area, you have to like put your campsite back together. So what I usually do.
Wait, so the tent stays on top of your car? Oh,
so
wow.
that's what. So usually it's better if you go camping with like a bunch of people. If you plan to do like all these activities that are like spread out, maybe. But like, so on Sunday I'm taking her, and so we're gonna do our activities on Sunday, and then I'll set the camp up like before it gets dark.
Gotcha.
And I won't have to touch it again. But yeah, I usually go camping with like other people that have normal setups. But
that's awesome.
Yeah.
I camped a lot when I was younger because it was something you can do. It doesn't cost a lot of money, and you get out there and have a good time. And I liked fishing and all that. But then I got married, and my wife absolutely hates camping.
No.
Yeah, so I don't really camp that much anymore. Every once in a while, I'll take like my kids, and sometimes we'll do like the meteor showers and go camp out like somewhere when it's one of the two big meteor showers in August or December.
Yeah.
But yeah, I don't camp as much as I used to. It's kind of a bummer. I actually really enjoyed it. But I mean, I don't want to drag my wife out there.
We should just go glamping.
Glamping? Yeah.
And I've been to like one of those nice like mansion style like cabins in Beaver Bend.
Oh my gosh, that'd be amazing. That's not even camping. That's just staying in like.
Yeah, it is. It's just like staying in a really nice, very wooded house.
Travis, you a camper?
No, absolutely not.
Have you ever been camping?
Absolutely not.
Never?
No, I've never been camping.
Man, okay.
Yeah.
All right.
I don't think that I would like be comfortable. Like, it's just not my scene. You know how you just know things aren't for you?
Yeah.
I think camping is just not for me.
I do know, man. Yeah, I get that. I mean, there are certain things I'm like, would you like?
I just like, sometimes when I go outside, it's like I can start smelling like the different, like last night whenever me and Avery were out like side, I could smell like fall was coming.
Yeah. Now
there was like something in the air, and I was like, it smells like fall. Like it just like smelled like it smelled like colder weather was coming.
So I do get that because I enjoy that, like when I'm either riding my motorcycle, like just like the smells of the countryside, or running too. I really do enjoy that. So yeah,
a good campfire smell too.
Oh yeah. Now I guess we do have like one of those fire pits. Does that count as camping if I make a fire in my backyard and sit out there with a beer?
As much as your wife is willing.
I know, right?
S'mores and then watching a movie inside.
Yep, and then going inside. Yep.
Yeah.
Well, cool. You guys have a great time. Be careful.
Yes.
And I can't wait to hear about your trip.
Yeah, it's gonna be fun.
Awesome. All right, so I got some pretty good topics today. Of course, I always sometimes will get topics from conversations I have in my office because patients will bring up things, and I'm like, oh, that's a great question, and something that, as somebody who does this and has been doing now for a couple decades, like you kind of forget what's common knowledge and what's, not common knowledge. And so I was talking to a patient the other day that came in. She came in for a breast issue, and she was really, kind of, I don't want to say like embarrassed, but she was just like, I have one breast that looks different, and like I'm, kind of self-conscious about it. And so I told her, I was like, that's a really common thing. And she almost like she, didn't realize how
she's probably never talked about it to anybody.
Yeah, I mean, I guess I get that a lot of people maybe talk about that kind of stuff, but then other people are more modest and they don't want to talk about it. And so I told her like that, breast asymmetry is completely normal. In fact, when I'm doing exams, I will, often make a big deal about if somebody has perfectly symmetric breasts. So I just want to talk about breast asymmetry and the ways that breasts can be asymmetric and what that means, and if it's, something that's concerning, and also if it's something that, you want to get fixed, what would you do to go about that? So I assume that you knew that, like, breasts are asymmetric. Yeah. I mean, a lot of people do know that, and so.
I mean, I feel like that's like with any part of your body. Like my right arm is bigger than my left arm. My right leg is chunkier than my left leg, but it's because of like muscle, and this side of my body is just stronger.
Right. Yeah, people sometimes get this idea that our bodies are symmetric, and it's really not true. In fact, there's a really interesting exercise where you can look at yourself in a mirror, where you're looking at a mirror like this, and there's another mirror like that. So what you see is a true mirror image of your face.
Yeah, like how other people see you.
No, not like in the mirror, but like, so it'd like be like your left side of your face, but then the right side would be your left side just flipped.
Oh, yeah.
And
that's on TikTok.
Oh, can you do that on TikTok? Oh, I've never done that. Yeah, I'm sure my daughter knows how to do that.
They're like try to see which side of your face is like the prettiest.
Yes. Yeah. And so you take a picture of like the left side of your face reversed, and then you do your right side, and you kind of look like a different person.
Yeah.
Because your sides are not totally symmetric, even on your face. So yeah, it's actually really normal for women to have one breast that's different. In fact, I looked up a bunch of research papers on this, and kind of the average is that it's around 88%, or just under 9 out of 10 women have at least one asymmetry of the breast. Now, there's of course multiple ways that the breast can be asymmetric. One of the most common is size. It's really common for a woman to have one breast that's like slightly larger, and this is something I see all the time because I do implants, and the way it kind of comes into my thought process is, does this patient need the same size implants, or do they need one implant that's bigger on one side to compensate for a smaller breast? And then also going the other direction when we do reductions, am I reducing this one by 400 grams and this one by 450 to match them? And so, I'm always thinking about that as far as the size. Next would be the shape.
Yeah.
It's very common, especially after women breastfeed, for one breast, maybe that was the preferred breast of the child, and they have a little bit more sag to it because of differences in how full they get with milk and whatnot. And then lastly is just the overall position of the breast. So we have this thing called the inframammary fold, which is basically where the base of your breast is. And it's really common for one to be, a centimeter or two, different than the other side. And so, sometimes people ask me, so like, what is too much when it comes to asymmetry for breasts? Because this is what I do. I do tons of breast surgery and, fixing breast problems. So, it is subjective, like what you would consider too much asymmetry. In my opinion, it's okay if breasts look noticeably different from one side to the other, as long as both breasts look okay, and it's not that they're so different it's distracting.
Yeah.
If it's one thing where you're like, okay, that one's a little bit different than the other, fine. That's really, really common. But like, so for example, if somebody had like a B cup on one side and a D cup on the other, well then obviously that becomes a little bit more of an issue, just like even wearing bras or wearing clothes. And so, like I said, it's normal to have a little bit of asymmetry. And when I talk to patients about having surgery, when we're doing augmentations or we're doing lifts or we're doing reductions, one thing I always tell patients is, don't get hung up on things have to be mirror image perfect. Ultimately that's your goal when you're doing these type of surgeries, to make things look perfectly symmetric. But realistically, you're taking two structures that almost always never look the same, and you're changing their shape and their position and their size, and you're trying to make them look exactly the same, mirror image of each other. And yeah, a lot of times, I can pull that off, more times than not, but sometimes you just can't make them perfect. And so you want to make sure that people are just realistic that, hey, it's okay if one breast looks a little bit different than the other. But, as far as like fixing those things, it's really common for me, size-wise. A lot of times we do that with either when we're doing reductions or when we're doing augmentations. It's really easy to add or take off a little bit more from one side to the other.
Yeah, I found my little implant card in one of my old purses. And no, they have two different sizes.
Do they? Were they off by a little or a lot?
I don't
Is this too
remember.
personal? I'm sorry. I don't mean to. Like,
I don't remember. I need to send
Sometimes
you
I
the little
forget
card.
myself. Apologies. Huh?
I need to send you the picture of the little card because it even says like my doctor's name on it because I
Yeah.
always forget who he is.
Yeah, I can.
I'm
I
sure
can
he's
tell you information
retired
about
now.
it.
He was old when
They
I
used to
read.
have those little things. They were almost like code. Like it would have like all these numbers, and if you just didn't know
It has like a serial numbers.
right, yeah, serial and not numbers. But yeah, like the identifying stuff was almost hieroglyphics, and they made them a little bit more simplified more recently. But yeah, I can tell you about them. But yeah, you can definitely add size or take away more if you're doing the other direction, a reduction. For shape, usually that involves a lift. You know, if you get one side that's drooping and the other is either maybe slightly drooping or not, you can do a lift on one or both to correct that, and that's pretty easy to do.
Yeah.
What's that?
I said yeah.
Yeah. The one that's kind of hard to do sometimes is position. So there's a lot of asymmetry in the chest wall of women. Like ideally, you'd like the breast to be facing forward, but it's really common for women to have what I call a canted chest, or almost like a pigeon chest. I mean, the big deformities be like a pectus carinum, where the chest is like this instead of flat, and so you'll get like breast facing like out a little bit. That one gets really, really hard to correct because the whole base of the breast is on basically a slope instead of being flat. So if people have that, I say, look, that's a natural variant. It's nothing bad. It just is what it is. And just make them aware of that it's a normal thing. If the breasts are off a little bit, like up and down, that's usually correctable if you're either doing implants or like a lift reduction. You can sometimes make the one that's a little bit, if it's implants, make the one that's a little higher down further, or vice versa. If you're lifting, you can lift the other one up a little bit more. The one that you can't really fix, that some people often will ask me about, is when the breasts sit far apart like this. So we call that the intermammary distance. Most women prefer breasts to be pretty close in the center because it makes that image of cleavage, and so when you wear your bathing suit or your dresses, like you have that just kind of nice shape. But some women naturally their breasts sit further apart, and it's really hard to try to force the breasts inward. I mean, you can kind of get away with it by using bigger implants to kind of make the whole breast base be larger, so it moves them in a little bit. But you can't really change the base of your breast. If your breasts sit out like this, if you try to like force them inward, what happens is usually the nipples will end up being a little wonky. So I just won't even do that. If the breast is still a bit far apart, they just still a bit far apart. But yeah, there's a lot of like just normal, variances that happen that we consider normal. And then there are ones that are more like congenital, like things like hypomastia, where one breast develops normally and the other doesn't. That can make them, pretty different. Those become a little bit more challenging to make perfectly identical. I did one the other day that was a tubular breast. I don't know if you've ever heard of tubular breast. So tubular breast is where the breasts are like very kind of narrow and almost like torpedo-like. And they look really kind of off because they're never the same. And those are probably some of the hardest ones to correct. They're correctable, but it's really hard to make them just look perfect. So when I see those patients, I'm always like, hey, this is like a really kind of unusual variant. I do lots of these surgeries, but just be aware that it's super hard to make these look perfect. But most people, when they go from something that's so far away from what they want to something that's pretty close, they're like, I love it. So, but yeah, breast asymmetry, normal stuff. So if you have asymmetric breast, then actually you're more normal than abnormal.
Yeah, I definitely do.
Yeah.
Pretty sure I do.
Yeah, pretty common. So, all right. Well, if you have any questions about breast symmetry or anything involved with that, please leave us a comment. I'd like to hear about it and answer your questions. Also, leave us a like, and also subscriptions help us a great deal.